A very good morning to everyone, and thank you AIOS for giving me this opportunity. I'll be presenting on the topic of post-vitrectomy recovery system. So it's a support furniture to help patients maintain face-down position after the retina surgery. So the problem statement is, so vitrectomy surgery has evolved dramatically over the past 50 years since the time Robert McKimmer introduced it in the year 1972. We live in a country with a population of 1.3 billion people, and going by the studies, we have an average incidence of about 1.3 lakh cases of detachments happening every year. So this is to give a rough idea. So the problem we are trying to solve is that vitrectomy surgeries usually require in certain cases for patients to maintain face down position for a period of 10 to 12 hours after the surgery, and the duration varies from 4 days to about 2 weeks period. So the prone positioning is needed for the tamponade agent, either the silicone oil or gas, to support the retina. But the real world scenario is that it is very difficult for the patients to maintain face down position, which is due to variable reasons like a back problem or the uncomfortable posture giving rise to chest pain or causing breathlessness. And when I looked back, there was no real way to track the duration for which the patients were maintaining prone position in spite of the doctor's advising. And the failure to maintain the position in certain cases can affect the surgical outcome. So the PVRS system, my colleague Harsh will just demonstrate. So it consists of a tripod-shaped furniture with a horseshoe-shaped cushion, the headrest, in which we have a sensor incorporated in the center at the heart of the horseshoe-shaped cushion. So it's a pressure sensor. When the patient places its head on the cushion, the data will be relayed via SIM card incorporated in the sensor, and the data is relayed to our website. We have applied for a patent for the same, and we have a trademark and design registration done. So this is version 2, and we have developed a backend and the website as well. So this is how the dashboard will be seen with the patient name, and we have a very easy to see and interpret bar diagram which will show the data on daily basis as to the duration for which patient is maintaining prone position. This is a short live video of our website taking you through the website details. So how the data is relayed is in a small pockets of data which will be displayed in just a few seconds. So this is how the data is relayed. There is a date timestamp. So every time the patient is maintaining a face down position for 10 seconds, 20 seconds and lifting it up, so the data will keep getting relayed to the server online. So we can keep a track and have a cumulative data at the end of the day. So we had done a small pilot study to investigate the validation of this device for patients after a vitrectomy surgery. So we had recruited patients who had undergone macular hole detachments and one patient with open globe injury. So what we found was overall the adherence was significantly better to maintain face down position, and patients showed a good compliance to maintain prone position by using the device. So what lies ahead for us is a bigger validation study is underway, and we are constantly working on more different devices for patients to maintain prone position, so this currently patients can use in the sitting position, and the headrest is detachable, so patients can take it and lie down on the bed. This has to be connected via power bank, which will supply the electronic circuit in the sensor. So it's very easy to use, and thank you.
That was an excellent presentation. Dr. Purendra Bhasin sir, your comments please.
Dr. Ahuja, I should appreciate the way you have developed this thing, and this is really a good thing. But one thing is there any study which tells us about how much time the patient has been in the prone position and the outcome of the anatomical outcome of the retinal reattachment? I don't think there is any such study which has been done till now. So that is what it is. How useful it is going to be.
That is very debatable, sir. You're right. There are studies for it, against it. But, clinical experience of senior surgeons, our teachers and mentors, what we practice is we do advise patients.
Yeah.
As a surgeon, we'll try our best to, achieve that anatomical success. Even if this gives an edge of 5 to 10%, if it increases the chances of success, we'll take it. And there is no harm or downside.
No, there is no harm as such, I tell you. But my suggestion is to have something, some device wherein patient can be comfortable and he can read also, maybe he can eat while in this position. If you can develop in that way also, that will be nice. But otherwise it's good.
Is the height adjustable for this?
Yes, ma'am.
Yeah, okay.
It has,
Ashish, I have a suggestion. Keep a iPad there so that if the patient's mind is engaged, he doesn't feel the neck strain. iPad here.
Yes, sir.
That can be something, some device.
Ashish, this is pressure based. There is a pressure sensor. What a patient like me keeps a pillow and walks away?
Sir, we have a weight. The sensor is sensitive to at least 1.5 kg of weight. At least, I think, above 1 kg of weight is needed for the sensor. We
don't
calibrate
reveal that, then we'll keep a brick and we'll go.
Yes, sir, that will happen.
He may be keeping head down but not pressing it. That is the issue.
Yes, sir, there are limitations.
Yeah. Thank you so much.